I'm Dr. Bansal. I am a neurosurgeon, senior consultant in Narayana Hospital, Jaipur. And as you know, न्यूरोसर्जरी का नाम सुनते ही लोग बाग कहते हैं कि साहब सिर की चोट, हेड इंजरी. ज्यादातर हमारे डॉक्टर्स भी, इवन मेडिकल प्रैक्टिशनर्स हैं, मोस्ट ऑफ देम, अगर आप उनसे पूछोगे न्यूरोसर्जरी के बारे में तो दे विल टॉक, अरे यार सिर की चोट, हेड इंजरी मीन्स न्यूरोसर्जरी मीन्स हेड इंजरी ओनली. But it's not the only head injury. The head injury is one part. Why this neurosurgery has become synonym with the head injury? This is because in India we have a lots of trauma, and in initial years, like 20 years back, when we do not have much of the CT scan and MRI and all kind of investigations, that time we just had CT scan at few places where the CT scan was used to be done only for the head injuries. The rest of the things like elective problems in the neuro, in the brain and the spine, like tumors, brain hemorrhage, and hydrocephalus, and there are so many things. There are n number of things which are there in the neurosurgery, which were been not taken care of, or which were not being considered in the initial days. So the only trauma was considered. So many of the people have neurosurgery means head injury in their mind. So now we have to keep trauma on one side, and then we talk about the rest of the neurosurgery. So इसमें जो न्यूरोसर्जरी का बाकी वाला पार्ट है, दैट इज दी, जैसे कि मैंने बोला, ब्रेन हैमरेज होना. ब्रेन हैमरेज भी कई तरह की होती है, जैसे सबरेक्नोइड हैमरेज होना, और इंट्रावेंट्रिकुलर ब्लीड होना, और हाइपोटेंसिव बेसल गैंग्लिया ब्लीड, या ब्रेन में लोबार हेमाटोमास. ऑल दीज काइंड ऑफ थिंग्स आर देयर. दिस इज वन पार्ट इज द ब्रेन हैमरेज, व्हिच इज आल्सो ए पार्ट ऑफ द न्यूरोसर्जरी. ये भी एक तरह की एक्सीडेंट है. दिस इज ऑल्सो ए काइंड ऑफ एक्सीडेंट विच वी कॉल इज द cerebrovascular accidents. Then the second thing, or the tumors or the congenital things. There are some things which are congenital, like hydrocephalus is congenital, encephaloceles are congenital problems, and then in spine, the spinal meningomyelocele, spina bifida, and all these are part of the neurosurgery. So then comes the neoplastic lesions in the brain and the spine. So there are so many congenital, or you can say the genetic issues, or the related with the genes, or you can say it's maybe because of the abnormality of the gene or the gene mutation, which can give rise to the neuro tumors, or what sometimes they are genetic, that what we call as neurocutaneous syndromes, like neurofibromatosis, von Hippel-Lindau syndromes. You must have all read in your all the curriculum somewhere or sometime. You must have encountered with all kind of things. Then in the skull base, like atlantoaxial dislocation, platybasia, or basilar invagination. This is one part of the congenital problems. And then now we talk about the neoplastic things. Neoplastic means the tumors and all. The tumors are the part of the arising from the any part of the brain. So we should start it from the below the bone. सबसे पहले, just below the bone is the dura mater. All the brain coverings are the three: dura mater, arachnoid mater, and the pia mater. So the dura mater is the toughest and the thickest layer of the brain, which is covering the brain. After the skull, or after that is the skull, you can say. And then is the arachnoid mater. Arachnoid dura is the tough. That's why it is called dura mater. The name has been derived from Latin word. And like the arachnoid is also derived from the we call this spiders. Spiders are arachnoids. Arachnoid is a family. So the membrane is so thin, but it covers the brain nicely, and which we can open, like the dura. When we open the dura, then we have to open the arachnoid also to reach to the brain. And then the pia mater. Pia is derived from the pious. Means it is a very, very thin layer. It is difficult to separate from the brain. It is actually a part of the brain surface. When we take the sections of the brain in histopathology, you can see the pia mater is the outermost layer. So it is difficult to separate from the brain. अब नीचे जो ब्रेन का पोर्शन आता है वो आपको सब पता है. ब्रेन में 4 लोब्स होते हैं, फ्रंटल, टेम्पोरल, पैराइटल एंड ऑक्सीपिटल लोब्स, एंड देन इट कम्स द ब्रेन स्टेम. And the brainstem part is the diencephalon and the metencephalon. So diencephalon is the portion which joins the spinal cord and the brain. So the fibers from the brain comes down to the spinal cord, and that part is called the pons or the pontine area of the brain, which is a swollen part of the area. So the pons, name of the pons has also been derived from the Latin word pons or the pont. Pont means is the bridge. So it is the bridge between the brain and the spinal cord. So the all nerves or the wires which are coming from the brain and come down to the spinal cord, and this is the area medulla oblongata, and then the pons, and then the spinal cord or the cervical spinal cord, it starts. So all the tumors which are arising in the brain can arise from even the dura mater or the arachnoid mater, which we call as the meningiomas or the hemangiopericitomas. They are more aggressive than the meningiomas, although the meningiomas are the benign tumors, but the hemangiopericitomas are the locally malignant tumors. They regrow and regrow, although meningioma can also regrow, but they grow at very slow rate or slow pace. But the arachnoid, the hemangiopericitomas are arising from the small vessels of the pericytes of the small vessels. So that's why it is called hemangiopericitomas. So they are more aggressive tumors. So they also arise from the coverings of the brain. And then comes the brain. And so in the brain, there are mainly 2 kinds of cells in the brain. You know, the neurons. So when the neuron goes down and it connects with the another neuron, then another neuron, till from the tip of front of your brain to the tip of your great toe. So there are the neurons are the most important part, which brings the sensation and which takes the sensation from the leg or from the peripheral area to the brain, and then give the command to go back to your part of the target organ. So this is how a circuit is being formed. So when somebody pricks a needle on at my finger, so it is so fast than the lightning even that the connection, the pain goes suddenly to the part of the brain there, and then it suddenly comes back immediately, and it causes the throwing away of the hand. So the pain should not be there. So that's how the circuit is being completed, and this circuitry is very, very complicated. So if you see this circuitry in detail, I know that everybody must have read in their physiology part of their early period of their training. So the sensation goes from here to sensory nerve, then goes to the spinal cord, to the spinothalamic tract, and then from thalamus to the frontal lobes, and then to the motor strip, motor cortex, and then from motor cortex it comes back through the same different part, but it's another part of the circuit, and then it asks the muscles, tells the muscles immediately to contract and to take your hand away. So this is how this thing works. So, and in the same way, our speech works, like what I'm talking and what you are talking is like part of my response, or when you talk and I talk, in your response is the part of the same way. It is the reflex of my body by your speech. So it is the motor, and this is the speech. So I'm talking about all these things basically because this is the basic and the groundwork, which is the formation of our further lecture, which I'm talking about. I'm going to talk about. So I think that this is very, very important part for every one of us to understand that how the brain circuit works. So then the neurons are being stabilized in the brain or being supported by the brain are by the cells which we are called the glial cells. They are the supporting cells, and they make the most part of the brain more than the neurons. Neurons are the wires, and they are around the wires to support them, to feed them. And the most important thing in this part is that the neurons, they are the permanent cells. They never divide. And you know that the cancer or the neoplasm is formed by the cells which divides. So the neurons are rarely makes the tumors. And then the glial cells. The glial cells are the only dividing cells. And you can say they are the white blood cells, like white blood cells. They are the white cells in the brain, or they are the squander cells. They provide support, they provide nutrition, and then they multiply, and then they degenerate, and they take out their dirty matters or the bioproducts, and then they dies, and then they have been removed from the body. So they keep on multiplying. So these are the most important cells in the brain which can give rise to the tumors, which we are called is the gliomas. Gliomas are the most common tumors in the brain, which are being grown from the glial cells of the brain, which are the supporting cells I just told you. So the gliomas can occur anywhere in the brain, from frontal tip to your tip of the spinal cord, even to because these glial cells are everywhere. And the other nomenclature for these cells are the astrocytic cells or astrocytomas. They are also called gliomas, are also astrocytomas. Because of the WHO classification, they call it astrocytoma grade 1, 2, 3, 4, like that. So these there are the tumors. So they become from the glial cells. They get neoplasms, or they multiply by the uncontrolled growth of these glial cells. Then the tumor, which is formed as the glioma or the astrocytomas. So according to WHO, they are being graded into 4 grades. Like grade 1 is when there are not many of the mitosis are seen in the histopathology in the tumor. They are the tumor, but they are very, very low grade tumors. They grow very, very slowly over the period of years. They doesn't grow even for 1 millimeter or 2 millimeter. So but if they are at some important part of the brain, they can cause some symptoms or some problems. The most common type of these tumors are genostocytic tumors in the brain or the cerebellum. And then the grade 2 tumors are called grade glioma, grade 2, or astrocytoma grade 2. There you can find occasional or sometimes more mitosis in the brain. So these are again very, very slow growing tumors. If you remove it completely, there is a very rare chance to recur these tumors. Or if they are being not removed, they grow very slowly. If they have no much symptoms, we usually don't operate these tumors. Then the grade 3 tumors are called anaplastic astrocytoma, or the glioma grade 3, or the malignant gliomas. So they are grade 3 tumors, so which can be like not benign tumors or not malignant tumors, but they behave as a locally malignant tumors. Like they grow not very fast, but not very slowly also. So these are the tumors which are grade 3 tumors. And then comes the grade 4 tumors, or the highly malignant brain neoplasms, which are called glioblastoma multiforme. You must have heard this name. Definitely, I'm sure. So they are the grade 4 tumors, or the highly malignant gliomas. So these tumors, they can give rise to, they are being either growth, or they can convert from grade 1, 2, or 3 to grade 4, or can be de novo grade 4 tumors. Like there is nothing before that. We have seen many patients, those who have been subjected for CT scan a month before for head injury or for some other problems like headache or something else, and the CT scan was absolutely normal, and after 1 month they start having some problems, and when the CT scan or we found there is a tumor. So these are the tumor which de novo glioblast, or there was some grade 2 or grade 3 tumors which can give rise to. So this is how this is important. The spirituality is that there are tumors which arises from different parts of the brain, the one part of the brain is speech area, what we call is the Broca's area. You all know that Broca's area is the speech part of the brain. What I am speaking is the motor speech. So it is called motor because I am moving my lips and moving my throat and moving my tongue. Then because the motor movements are required, so it is called the motor speech. So the Broca area is the motor area of the speech. Then the other part below the I will show you this from one of my specimen. The left side, this is the part of the brain. Above is the Broca's area, or we call it area 44, and then below is the Sylvian fissure, and just below is this is the temporal lobe, and upper part of the temporal lobe is the Wernicke's area, from where what I am speaking is coming from Broca's area, and what you are listening is coming from the which you understand is from the Wernicke's area. If you somebody has damaged this part of the temporal lobe or Wernicke's area, he will not be able to understand what somebody speaks. And if this part of the or Broca's area get damaged, nobody can speak. He knows that what to speak, but cannot speak. So this is the only area of the brain where the speech is being generated. So, but if even the lesion is not here, sometimes the lesion is here, which is pushing this area. Sometimes the lesion is here, which is pushing this area. Sometimes here, which is pushing this area. So speech can go in all these circumstances. So, but what I'm speaking and what you are understanding by my speech is being connected by these circuits. This is circuit here and here. So this circuit is called arcuate fasciculus. So this arcuate fasciculus from here, Broca's area, to this Wernicke's area, it goes like this. So this is how I speak. This is how I speak, and this is how you understand. And then by understanding, you speak again, then I understand. Like with this, by the arcuate fasciculus, then I respond with what you speak, answer your question or whatever. We converse with each other like this. This fasciculus is very important for all these conversation what we are doing. So this today's speech was by the Omnicorus is being kept for the spirituality. Like this part is this patient was having a tumor in this area from where he speaks. So what happened to him was he used to have a speech arrest or the seizures. When he had epilepsy or seizures, we can call seizure is when there is a one episode. If there is a multiple episode, we can call it as an epilepsy. So the seizure or epilepsy are many kinds. Like you can say there is a motor seizures, when we call it as a GTCS, generalized tonic-clonic seizures. When patient has the seizures like this, and then patient becomes quiet after sometimes. This is generalized seizures, but usually it starts from one part of your body, maybe from this finger, maybe from this hand, and maybe from leg. It depends on wherever the pathology is there in your brain. So this patient had a tumor here. So he used to have seizures, repeated seizures. This is the one patient, and another patient I operated 2 years ago. He also had the lesion at the same pathology in the same Broca's area. So whenever he had seizures, he used to have speech arrest. उसकी आवाज बिल्कुल बंद हो जाती थी और वो बिल्कुल बेहोश हो जाता था, और उसके बाद में जब वो जागता था तो होश में भी आ जाता था. Then still he was not able to speak so many things, like the names. Just suppose he wants to take water, he used to ask her, dena, please give me that. But he was not able to name the things. So that what we call is a naming aphasia. That's a part of the Broca's aphasia. It's a part of motor aphasia. So this patient had the tumor here. So after he consulted me, after going to so many doctors, and because he came to me because of the internet, I did a similar kind of surgery 2 years ago to a same patient, same kind of pathology to a patient who also had a speech arrest or the speech seizures. used to have difficulty in calculation because he was a computer chartered accountant. He was a chartered accountant. So he used to have a difficulty in calculations. So then he had seizure and he became unconscious, speech arrest. So the investigation was done, and then he came to me. And by seeing that patient 2 years ago, he came to me again, looking into all these things, that he had also same problems. So he came to me. The 2 year ago patient, I asked him to, I want to operate you when you are awake totally. You will speak or keep on speaking. Whatever we are asking, you will be answering. And we ask you to we'll give you some object. You have to answer. Tell us that what this object is. And we have to ask you, give you a newspaper also to read that. And we will play music also, song also. Whatever you say, you have to speak along with that song that you have understood. So why I said this thing, this is a very important question, because when I will say somebody that you have to speak during the operation, so at first he will be afraid. Most of the patients will be afraid that how can you operate me while I am awake. So then I said that I want you to be awake. I want you to converse with me during surgery. I want you to move your fingers like right finger, right hands, first finger, right hand, third finger. So that gives me a lot of meaning, lot of meaning, that you are understanding properly what I am commanding you and what you are responding to, that you have all the circuits are active into your brain, that they are all functioning very well. So like this patient and the previous patient, I asked in the morning that I want you to operate on when you are awake. So he said, okay. I said, you have to cooperate with me. We will give you local anesthesia in the brain, here in this left side of the brain. So then you have to follow my commands, and then you have to answer me what I am saying. Then I asked him to what you want to do. Then he said, I will keep on speaking Hanuman Chalisa during your surgery. So I said, that's fine. But he didn't know actually what Hanuman Chalisa means. What I told him later, that you are a very intelligent person, you may not be knowing this, because Hanuman Chalisa is the spiritual mantra of our country, or our Hinduism, or our India, that it contains all the alphabets of Hindi letters. So if you can verbalize, or if you can recite the Hanuman Chalisa beautifully, it means you are not missing any letter of our Hindi alphabet. So this was a beautiful thing by him itself. And he started when we put the incision here, then he didn't have any pain. Then we infiltrated the local anesthesia, and then we removed the bone here. And then after removing the bone, I touched the brain here, and I saw the tumor here. And then I told him that I'm touching your one part of the brain. Can you speak something? Then he kept on speaking. Then I touched some other part of the brain, like around that area. So I kept on asking him, what is your name, what you can speak. And he kept on, in between, he kept on speaking, reciting the Hanuman Chalisa. And the second patient now, he was speaking reciting the Gayatri mantra. So both are the mantras of, they have all the alphabets of Hindi. So by that, you can judge that he can speak all the letters. So I have seen so many patients, those who have some selective aphasia, like they cannot speak some particular words, like in Hindi. He can, if you ask him to speak something later, so if there are in our brain, every letter has some part of the brain is having that reserve, that part of the brain can speak only that letter. So this is a very, very deep study, and very interesting study also, because the speech is the biggest part of our day-to-day life. So if somebody removes this tumor when he is unconscious or during under anesthesia, then he might lose his speech. So we planned this surgery because we wanted to keep his speech intact. So he agreed to that. Similarly, second patient, So the spirituality works in, he is reciting his God's name. So when he recites his God's name, his faith into the God becomes more and more stronger. And then the second thing which is good for us is that he is able to speak. So we are not damaging his speech area while removing the tumor. So this is the most important thing, that his speech remained intact in both the patients. We have the videos of all that. These are all uploaded on YouTube also, now also, in 2 years back also. And then we removed the tumor by one piece in piecemeal. We completely removed the tumor under microscope, and with my team of neurologists, and they kept on giving him command while I was operating under the microscope. You can see all these videos on the internet, on the YouTube. So while we were operating, I was operating on the microscope and asking him to speak something. We have shown him newspaper, ask him to read. We have given him coins to feel it and then tell us what is this. If he says this is the coin, what coin, how many rupees of this coin is 2 rupees, 5 rupees, like this. And then we have to give him pen also, that what is this. He used to tell pen and watch and rings, like this rings. So there are so many things which we can identify by feeling also. So he's touch is also intact. And then we asked him that you move your right leg. So if he's moving right leg, it means he's properly taking the command and he's properly executing his command, what he is understanding. And then moreover, his motor part is also working. This is the speech area part, which he is understanding and then is executing. And then he is moving the right leg. It means his motor part of that brain is also active. So that is also working. So we know so many things by giving command and by seeing him executing properly what we have told him. So that is how the things works. And definitely the spirituality is very, very important, that the patient has a lot of faith in, because we are all Indians are all spiritual. Although everywhere in the world, I have seen people around the world. I have traveled around the world in all the continents, and I have seen people, they are spiritual. If they are not very religious, but they are spiritual. Everybody has faith in the God. So when you have some very important work in your life, like when we have some serious work or very important kind of work in our life, every time we remind our God, we remember our God. So this is a very important part of his life while he was getting operated for the brain tumors at very sensitive area. So that if that time he spiritualizes and he realizes, become religious, that is very good for him. So that's how the thing goes. And then we removed the patient's tumor completely. Both the patient's seizures have been fully controlled after removal of the tumors. Then we have sent these tumor tissue for biopsy, histopathology. Both the tumors came out as histopathologically as a astrocytoma grade 2. And then I didn't stop at that point. Then I sent this tumor for the genetic analysis also. So there is one kind of gene which we call as 1p19q. So it is a part of the 1p and 19q, which if it is deleted, in both the patients, this 1p19q gene was deleted. So if this gene is deleted, it means if tomorrow the tumor grows, we give radiotherapy. So with the radiotherapy, these tumors will respond very well. So this moreover 1p19q is a kind of benign tumors, like it comes into the benign tumor category. And once you remove the tumor, the seizure stops, speech arrests, stops, the speech has become better, and the patient's seizure has stopped, the tumor is removed. The tumor, and this patient, which I operated 2.5 years ago in May 2019. Yeah, 2019 May or June, I think. And now still there is no growth. I am following all these patients every 3 monthly and every 6 monthly and getting their MRI done and seeing their MRI. If there is no tumor, it means they are working well. So this is how the spirituality works in surgery. We have some simple operation, like if if there is some pus, doctor, general surgeon says that we have to give some chira or incision, then also we start praying to the God. And if we go for appendix or some any kind of surgery, even smallest surgery for cataract or whatever, something, every time we remember God. So in this patient, these kind of big tumors also, if we remember God, it can become a big thing, and which helps not only to the patient but also to the doctor also, because we can converse with them. We know that we are not damaging his very important part of the brain, and at the end of the surgery, we feel proud that we have killed the enemy and we have not given him any deficit or any problems to the patient. So this second patient, on the same day evening, when he got up, he said, I want to go home now only, and I want to walk for at least 5 kilometers now, because he was a retired military man. And the previous patient was also on the second day morning after the surgery, like he was operated today and tomorrow morning. He got up from the bed and he said, I'm going home. Give me discharge. I don't have any problem, because he did not went under general anesthesia. And when we saw him, all his videos, he was very amazed that I spoke everything and I'm intact now, and you removed my tumor. So this nothing can happen better in their life than this thing, that their disease is gone and they are still healthy and happy. So removing the tumor and not damaging the most important part of the brain